uh, kind of along for the ride on the needs assessment piece.
And was there anybody else from Maine Care you wanted to?
There's nobody else from Maine Care on.
Okay, great. So back to you, David.
Great. Thanks, Paul. And then joining me today from Guidehouse is Chelsea Mahoney and Karen O'Driscoll. And then Justin Rudder, our project manager, will be joining us shortly. We actually have a fairly large team, but today this is who we have for this meeting. It'd probably be like to hear who the stakeholders are, because I know we have a lot of folks who are familiar to Maine Care and ODES, but also may not be necessarily familiar to each other. So if you could just sort of briefly say your name, and then, if a brief statement about what you hope to get out of this work, that'd be great.
And could I just suggest that we take the PowerPoint down for a minute so we can see each other on the introductions? That would be great.
And people can just jump in and we'll go from there.
So I'm Brenda Gallant, the Long-Term Care Ombudsman. And as you know, the Ombudsman program provides advocacy for residents in nursing facilities and in assisted housing, residential care, assisted living. So we're just really excited about this project because we, as advocates, we're really excited about tying payment to quality and the opportunities to look at maybe regulatory reform involving staff and residents in their perspective around care and quality. So, and we just really are excited about being engaged in this work. So.
Great, welcome, Brenda.
Thank you. And with me is Gretchen, if you wanted to introduce yourself.
Sure, good afternoon. Gretchen Zay Higgins, and I am with Maine Long-Term Care Ombudsman Program as well.
Welcome, Gretchen. Others, just feel free to jump in.
Hi, my name is Nem Knight. It looks like I can't change my name on here, so I'm sorry. It just says that I am a Quality Maine. But my name is Nemison Knight. I work with Quality Maine and most specifically work with our network for older adults. So we serve older LGBTQ adults throughout the state of Maine in a variety of different ways. So also glad to be here and learn a little bit more today about what's happening.
Great, thanks for taking the time. Others?
Yeah, hi, I'm Jay Martin, Executive Director at Legal Services for the Elderly. And I'm just very interested to learn about the structure for this process and then support it in any way we can. It's just a critical step in the overall, meeting the overall goal.
Great, glad to have you, Jay. Others? Don't be shy.
Hi, good afternoon. My name is Angela Westhoff. I'm the president and CEO of the Maine Healthcare Association. We represent about 200 long-term care facilities across the state, including nursing homes, residential care facilities, and assisted living facilities. And similar to Brenda, I'm really excited about this project. I have a background in public health and have conducted several community health needs assessments. So I'm curious to see what this process is going to look like. And also with respect to Peter's comments about how this needs assessment is going to be tied to rate reform, of course, very interested in that project as well. So I think there'll be some good synergy here, and I look forward to learning more today. Thank you for the opportunity.
Welcome.
Hi, Christina Taylor from Alpha One. I work out of the Bangor office, but we cover the entire state of Maine. We're a center for independent living, and I am here because I was told to be here, but very excited to be here.
Well, hopefully we'll make best use of your time.
My name is Jill Carney. I'm the Director of Public Policy for the Alzheimer's Association here in Maine. Excited to be here because, our community does rely heavily on long-term, supports and services. So we're excited to, help, improve access here in Maine.
Great.
Hi, I'm Sharon Fusco. I'm with the Maine Veterans Homes. We have 6 homes across the state, but I also have a long history working in long-term services and supports in home and community-based services. Have been through a few Medicaid changes, major statewide changes and so forth, and processes to revamp how those services are delivered, how they are paid for. And so certainly interested, like Angela, on how this will influence the rate setting, but also just to be a part of seeing how Maine evolves its system of services and support. So should be fun.
Great. Let's see, I think there's a few others.
Hi there, I'm Tracy Smith, LTSS Director at Seniors Plus, and I am generally interested in any opportunity to improve the system as a whole. Nursing facility respite has been a challenge for many years, and so I'm just looking forward to some improved outcomes and excited to learn more about the system.
Awesome, welcome. I think that's most people. If anyone else?
Wondering about S. Fisher.
Oh, that's Sharon. She's with us.
Okay.
She's with Guidehouse. And I should probably introduce Sharon. Sharon is also on the needs assessment team here at Guidehouse.
Hi, everyone. I'm purposely staying quiet so I don't start coughing again. See everyone. I'm happy to be here.
All right. Chelsea, if you want to put the deck back up. All right, let's go to the next slide. So why are we here? So as you heard from Peter and others, ODES and DHHS have hired and engaged Guidehouse for two key purposes. One, to help them review and redevelop their nursing facility and residential care facility rates. That's one part. The other part is the purpose of why we're here is to conduct a broader LTSS needs assessment, looking at the continuum of care, both from the demand side and from the supply side, right? And put it all together. And as Peter said, some of that will inform the rate setting, but from a larger sense, it will inform the broader policy goals of ODES and Maine Care. So today, what we hope to get it, as I mentioned, part on the agenda, we have a couple of questions that we'd like to get some input on, and those include trying to understand from you if the services that we will put up are the services that you would consider part of the LTSS continuum. Try to get a sense of what metrics would be useful and required to conduct that assessment effectively, and what we mean by that is, what measures can be used to determine if a particular service is sufficient in a particular area. And we'll get a little bit more into that as we go. And then talk a little bit more about providing input on the overall exercise objectives. In other words, near, midterm, and far as to what the overall goals should be, sort of next 5 years, 5 years after that, that sort of thing. Next slide. So what are the goals of the work group? And I know, Paul, you had some comments as well. And so I'll just sort of run through this and then I'll pause and give you an opportunity if you had anything to say. So, as we just said, we want to identify LTS services and gaps. And the metric of analysis really is at the county level, but we also may do a deeper dive into health service areas. DHHS also they want assistance with methods for modeling future needs. In other words, what things look like today in the current state, but also as the population and demographics change over the coming period, what they need to know going forward. And of course, this will serve as a guide as to how they can invest in how to look at sustainable living in the state of Maine. As we talked about, addressing the broader continuum of LTS services. And then lastly, as we mentioned, this group is intended to meet for a series of meetings over the coming months, estimated probably 4 to 5 times, and we'll continue to do this on a Zoom basis. But I'll pause there. And Paul, did you want to say something?
Thank you, David. I just want to comment on, I know many of you are aware that we have one other group that's already going and has been referred to, which is the rate setting group. And that group is focused very specifically on establishing a new rate methodology and new rates for nursing homes and PNMICs. And toward the end of this month, we'll be convening for the first time our Nursing Home and Residential Care Quality and Innovation Council, which will take up, larger questions of how we ensure access to appropriate and high quality residential care options in Maine going forward. But we all know, you all know, because you're all expert in LTSS in one way or another, that these things are all interrelated, that the number of nursing home beds that we need depends in part on how many residential care homes beds that we have, and relates to how much home care we have in a particular county. And so we want to ensure that Mainers have access to a range of options for sustainable living in the future and in the communities of their choice to the extent possible. We have information about the capacity of the system at a state level, but we also know anecdotally that there are certain parts of the state where the gaps are larger than others. We also know that our demographics are shifting in Maine. We're already the oldest state in the nation, and that trend is going to continue, which has implications for how much LTSS we need. So this is really a very important building block for us that's going to establish a baseline of where we are now coming out of the pandemic. How much LTSS capacity do we have by region, and how much do we think we need? So what are the gaps, and what are those gaps going forward? It relates to the two other groups in a couple of ways. Peter already mentioned how this could impact rates in terms of prioritizing certain types of care or areas of the state where we feel the gaps are particularly large. So that's just one example. And certainly this work can inform where we would choose to do a targeted development effort in the future, whether that's for home care or for more res care beds or for nursing homes. So we think this is pretty fundamental. It's fundamental to the Cabinet on Aging's priority to promote sustainable living in Maine. And we are looking forward to getting your help so that we are looking at the right things and measuring them in the best way that we can, given whatever data limitations we're going to encounter, no doubt. So thank you for being here, and we are looking forward to doing this work.
Great. Thanks, Paul. Next slide. So as you know, this slide is sort of self-explanatory based on what Paul just said. What the overall objective of what Guidehouse is here to do. And as you heard Paul say, the Cabinet on Aging has a keen interest in sustainable living, and this tool essentially that we're creating is going to inform a number of elements, not only the rates, but inform a number of policy decisions going forward. So again, this is critical, and this is very important, and I know the agency takes this very seriously. Next slide. Okay, I'll turn this over to Maine to walk through some of the sort of current statistics and numbers they have.
Thank you, David. Hi, everyone. So yes, we have a few slides that we want to just show you. It'll only take a few minutes, but really these slides demonstrate the LTSS expenditures and the balance between the community services programs and institutional level of care services known as nursing facilities. So as you can see in this slide, that the public expenditures for LTSS for older adults has increased by $50 million from 2018 to 2022. And then nursing home expenditures have decreased by about $14 million during this period. And of course, as most of you understand and realize, that this reflects both a reduction in the bed capacity and decreased occupancy during the pandemic. And then growth in community-based LTSS for older adults more than made up for the decrease in the nursing facility capacity, increasing by $64 million during this period. And so this next slide really just, can you go back one? Slide 10?
Sorry, I thought you would jump to the other.
That's okay.
So my apologies.
So what folks will see, it's okay. So what folks will see is the same information, but just demonstrated a little bit differently. We understand that people see things a little bit differently. So what we did was we created a bar chart, and then we also created this pie chart. So this is basically a reflection of the previous slide, which is the bar chart, but it just shows you the differences. So in this chart, as you can see, the nursing facility expenditures as a portion of the total LTSS spending for older adults decreased from 60% in 2019 to 53% in 2022. Next slide, thank you. And so again, this bar chart is really depicting and is focused on the community LTSS expenditures. And just a couple of highlights to note here, that every community LTSS services expenditures for older adults increased over this time between 2019 and 2022, except for adult day health services. And that the largest increases were under Section 19 Waiver Services Program, which increased by $42 million. Wow. Personal care, PDN services increased by $7 million. The PNMIC program increased by $6 million, as well as our state-funded programs also increased by $6 million. And then slide 11, again, is sort of a busier view, but it also just demonstrates the percentages and the increases by program services. So really, what does this mean? What this means is essentially what Paul just talked about and David reinforced, that, you know, although this data demonstrates the resilience, you know, of the community LTSS services, even during the pandemic, and it highlights the importance of strengthening the types of LTSS services we provide. We also need to, we also understand that these services are uneven across the state, and that this project is going to give us a map of capacity and needs across geographic areas, which will enable us to strategically target our development efforts into the future. Do folks have questions or comments before I send it back to Guidehouse? All right, thank you. David?
Thanks, Karen. Okay, so we're going to next talk a little bit about, you know, how we intend to approach the needs assessment for the LTS services. And I'm going to turn that to Chelsea, who is actually driving today also, or driving the slides, excuse me, not driving a car.
I don't know, can I walk and chew gum at the same time? We'll see. So welcome everybody. Thanks so much for participating today. We are really excited to get some feedback from y'all. Of course, we're giving you a lot of information at the beginning of this presentation today, but we definitely have some opportunity to get more feedback and ideas and input from you. Towards the end, we do have an activity planned. So just starting off, we wanted to share with y'all what we identified as LTSS services that we will be including in our assessment. I'm not going to read everything off the page, but I will give you the opportunity to read it yourself. But we did break it down by type of care here. So I'll give you a minute, but please let me know if there are any questions.
Hey, I just want to jump on with a quick question. Thank you for this. Just wanted to ask about memory care facilities. Would this fall under one of these classifications, or would that be a separate thing to consider.
That's actually a great question, but Paul, I'll ask you where that would fit in, but absolutely, the answer is yes. I mean, memory care is clearly a component of LTSS services, but.
Right. I think that we want to look, I see that under residential care here, which is, you know, the fourth arrow down, we have adult family care homes and PNMICs. I believe it should be broader than that. I think we need to look at the range of residential care options that we have, because that's where most of the memory care facilities fall, is as a type of residential care facility. And yes, I would think that we'd want to look at that.
Yeah,
and I'm
Jill,
pretty sure well, we'll get into methods and limitations later. I was going to ask Bill. I'm pretty sure that that we know which facilities are designated as memory care. What we don't know is other facilities take people with memory needs, right? But they are not necessarily designated as memory care facilities.
Correct.
Right.
They would fall into residential and or nursing homes that have designated or distinct part units for memory care.
Yeah.
And it's one of the peer groups for the PNMICs. So.
It's more than just the Cs, though. It's other types of residential care as well.
All right.
And Jill, that was a great question, and that's actually one of our activity questions coming up. And so we can also come back to this slide if that'll help folks. But so if you guys do have any other ideas or questions about this, if you want to jot them down, then when we speak to them in a minute, you'll have those notes available.
I think if you don't mind, Chelsea, I think it's worth just spending a minute talking about what we think each of these levels represents, and then the details within it we want people's help with. But there's a constellation of things that are delivered in your own home, and that's the first category. And then adult day stands on its own, because these are services where you're likely still living at home or with your family, but you're going somewhere else during the day. And if there are other examples other than adult day centers that we just don't know about, you know, we'll want to know more about that. The affordable living we have separated out. It is residential, but it's unique in that you have your own apartment with a door that locks, your own space with services that are available in the building. So that distinguishes it from residential care, the next category down, where you're likely to, you may have a private room, but you don't have an apartment. Most people have a roommate, and then you have shared services, dining, and so on. And then people are familiar with nursing facilities. So.
Okay.
Thank you, Paul, for walking us through that. I think that was helpful for all of us, just to level set and make sure that we're all aligned on the different types of care. Any other questions or ideas on this slide before we jump over to the approach and then dive into our more interactive portion? Okay, hearing none. This is a pretty high level view of, yeah? Oh, okay, high level approach to the LTSS needs assessment. And so of course, today we're hoping to confirm the list of the services or facility types that we should be assessing and collecting data on to inform future decisions and policy. And then also we'll be mapping population by age and income and looking at what it looks like today, and also some future forecasting to help anticipate what the future needs might look like. And then developing metrics to assess the services against. So also we'll be asking for your input on what metrics are important to you, or what you feel like has the most value as you look towards the services in Maine, and how we can better position Maine to be able to provide those. And then another step would be mapping out those services against the current populations and needs. And so if you look at to the graphic on the right, this is an example of some of the outputs that we'll be able to provide to you in Maine. I realize that this is fairly small, but it is a graphical depiction of where services are currently, of where they are. And then on the right is looking at utilization, and this green bar is kind of like that sweet spot of the 80 to 100% utilization, but we can also develop other views that can map population growth needs against where the beds currently are and against different service types. That's the different colored dots. So just wanted to kind of walk you through some examples of what we're looking to populate to help inform some decisions. So again, applying logic of growth patterns to identify some future needs and where some of those gaps are. And then we would be producing a needs assessment report finally to provide some additional information and context. Any questions, concerns, or ideas on this current approach that we've established for the needs assessment?
And again, some of the questions coming up, we'll ask specific things about this. So that's, you'll have an opportunity to actually, opine.
Thank you, David. So we'll move on to the discussion piece, and just quick discussion etiquette. Of course, if you want to try raising your hand and making sure that you're muted when you're not speaking, please utilize the chat box and just essentially be respectful of the group. I think that we all know how to conduct ourselves and we don't anticipate any issues, but wanted to share. So moving forward, as we consider the needs assessment, we'll be discussing the following 3 questions. Again, coming back to what services and facility types the assessment should focus on, what metrics should be included to help determine needs, and then lastly, how should we measure needs within the Maine community within LTSS. So I'm going to pause for a second and regroup my presentation. So give me 1 second if you don't mind. Stop sharing. Just gonna pull up the actual PowerPoint so we can do some live edits in there. So thank you for bearing with me. So typically we would have folks in a shared document, but what we'll ask that y'all help with today is to use the chat to let us know any thoughts that you might have on the facility types and services that we shared earlier. And if it's easier, I'll just go back to that screen so that you can see it. Are you seeing my screen actually?
No, this is good.
Yes.
Okay, just wanted to make sure. So I'll actually share this screen, and if folks can utilize the chat to include any other types that they feel should be included, or if anything is on here that they don't agree with.
And then as you do that, we'll post them on the Post-it notes so you all can see, you can be able to see not only the chat box, but you'll be able to see the Post-it box. And we're capturing this information. In other words, we're recording this.
And if folks would rather just speak up, you can just do that as well.
Kelsey, maybe it would be helpful to type the question in the chat box as well, so that helps with looking at this.
Okay. So Jay, I see you have a different question. How will potential waiver funded services that Maine is not providing be included in the assessment? For example, Tennessee support services.
I think that's an example of a gap that we know exists today because we don't provide it in the waiver. And so we should definitely capture that along with other service gaps that people identify so that we can think about how we reflect that information in the assessment.
Oh, tried to put that in the chat, but it's not going to let me. So, oh, excuse me. Okay. So we have tenancy support services. Jill, I see that you memory.
As you're, this is Jill again, as you're typing, and I just had another thought that maybe it's better for me to talk about because I'm still thinking through it rather than and then type it in the chat. I'm curious as to caregivers, family caregivers that, you know, reaching the people who may be eligible for services but are not accessing them. Is this kind of beyond the scope of the LTSS assessment, or is that particularly, you know, a type of population that we might want to try to capture or, you know, look at?
I think we should identify it, Jill. So, and again, then decide, you know, whether, I mean, I think the challenge, just jumping ahead in our process a little bit, the challenge with caregiver support is we don't have good ways of knowing how much of it is needed, et cetera. Though I certainly think of it as the very start of home care, if you will, is caregiver support. So it kind of fits in the home care bucket for me, but whether we'll be able to measure it or not is a question. I think we should definitely capture it though.
Thanks. Yeah, that was kind of my thinking, that it's right at that, you know, beginning, beginning phase of home care. But, and certainly we have lots of hours of, we all know, lots of hours of unpaid care by family members.
Hi, this is Gretchen at Ombudsman Program. I don't know where this fits in either, but past our specialized services, I know would fall under Section 67, but I feel like there's some areas that could be looked at there. And our PNMIEs that don't provide personal care, we try to move those individuals into PNMICs. So maybe that's just another gap somewhere. Just a couple of thoughts.
And Chelsea, I'm capturing things that folks that say. You know.
Thank you. I'm trying.
Yeah, no, you're doing a great job. You're doing a great
Gretchen,
job.
could I ask a question? When you're talking about PASSAR, can you say a little bit more about what it is that you look for?
Specialized services,
right? They're tied to
facilities,
nursing facilities. Yeah.
Yeah, facilities being able to access those.
Just access them. Yeah.
Yeah.
Yes. Well, and we do just, I mean, again, just as a quick aside, we do have a consultant that is going to start working with us around PASSAR. So we're excited about that initiative, and that might end up informing us on this initiative as well.
Yeah, that's good news. That's exciting.
Yeah.
And again, just as a general rule, I mean, this is in the spirit of brainstorming. I think we capture all this stuff, and then we're going to encounter some data limitations, and we'll have to decide, you know, like Gretchen mentioned PNMIE. For those of you who are not familiar, those are residential care options for people with significant mental illness. But like everybody else, they develop a need for personal care and ADL care later in life. And so do we think about them as being part of our LTSS system or not? I think, let's put it down and we'll decide whether that we have a practical way to try to capture that.
Yeah, this is Jay, and I just would also clarify on my comment. I mean, I'm happy to see the tenancy support mentioned, but I think I was trying to raise to this little bit of a chicken and egg question of, are you evaluate what you've already decided to provide with the waiver or the potential of the waiver as it relates to the needs? That's, I think, what I was trying to lift up, because that I suspect is only an example of what might be currently opportunities under the waiver that Maine isn't currently pursuing. So.
Oh, I think it's great to put those down, Jay, for sure. Because like Paul said, if we start out with mapping what we have, and then really we should know what others are thinking about what it is that could fill some of those gaps. And do we have some innovative ideas to look at?
I'm sorry, this is Brenda. I just wanted to quickly mention, at some point, I think it would be helpful to look at those people that, or get some sense of people that have had to receive care out of state to get an idea of what we might be looking to develop in the future because it's really unfortunate when they have to be moved because we can't find care here. So thank you.
Chelsea, just keeping an eye on the time, we should probably move to the next question. But folks continue to put information here. We have an hour, so we have 2 more questions to get through. So we apologize if you didn't have a chance to include it, but please continue.
Well, hey guys, this is Sharon, and to kind of piggyback on that question, just thinking about it a little bit differently. Is there information or data today that allows you insights on those, it's the vacation land, right? So thinking of those coming from out of state to Maine that are getting services for a portion of the year and then migrate somewhere else, or, kind of what that looks like for folks either moving into the state and the services that they're getting partial year or full year, right?
I think that's a great point, Sharon. There's folks who live in Maine who have to get sent out of state for services because of lack of access within Maine. And then also looking at folks who are part-time utilizers. I hope nobody's offended by the term snowbird. That's just how we refer to them in Florida. But we do have to time check. Are there any last thoughts on services or facility types before we move on to metrics? Okay, so love the conversation. So hoping to keep that going. We want to discuss, what are some obtainable metrics that would be useful to inform Maine's ability to support its aging population. So what do you typically look at? Or what are some standards or additional ideas that you might have?
And just by way of example, when you think of the institutional care, you think of number of beds or beds per thousand population. In other words, and those are things that we can easily measure and capture in those typical provider types. But as you think more of the community and HCBS type services, the kinds of metrics that would be valuable in terms of understanding both the demand and the availability of services, whether it be, take PCA services in the home or other types of services along that continuum.
Okay, I see Tracy has an idea, so I'm going to go ahead and put that in here. Unstaffed home care hours tracked by the SCAs.
Service coordination agencies.
Thank you. I didn't know what that was, but I assumed others did. Service. And when you say unstaffed home care hours, is this like family hours?
No, these are all unstaffed hours, not including informal supports.
So hours that should be staffed, but the need is unmet?
Correct. They're authorized hours in the care plan, but due to a shortage of providers and or caregivers, they remain unstaffed.
Okay, thank you for clarifying that for me.
You're welcome.
Just to piggyback on that, there's a huge lack of nursing support. We have a lot of consumers with like 1 hour a month of nursing in their plan of care, or an hour a week, and they've been on a wait list for years and years, just because there's no agencies that have the nurses available to pick them up.
So just to recraft that one in to address sort of how we measure that, you're saying sort of number of nurses available in a given area, and you're talking about institutional nurses or nurses in home care settings?
Home care settings that would travel to the consumer's home.
I see. Okay, so
yep.
Okay. And that would be provided by agencies, presumably, correct? Christina.
What?
Oh, that's agency. Would be provided by agencies?
The service coordination agency, we keep a track of all of our consumers that have nursing in the plan of care that are unstaffed.
And yes, David, the nursing hours would be provided by either an agency or an independent nurse. That Maine Care does pay for independent nurses as well.
Okay.
As opposed to the personal care, which is the other part of the equation here, where it could also be, through a self-directed program.
Correct.
I have a question. Would tracking agency nurses be something that would be helpful? Like how much Maine is using travel nursing? I know that that's usually more expensive than like a typical staff hire.
Sure, I'll jump in there. So there's actually a bill, LD 451, before the Health and Human Services Committee, and we just had a work session yesterday, and it's been tabled. But one of the things that bill would do is create a data collection process, so that the Division of Licensing and Certification would have a better sense of cost related to agency staffing. But you're absolutely right; it has increased tremendously, and the cost is skyrocketing.
Yeah. As a nurse, it's kind of great, but as as a facility and folks who are trying to run them, it's a nightmare, right?
Yeah, and just a reminder for folks, we're going to have to come to a point of making decisions based on what data we have or can readily get. This is an example of something we don't collect currently. Each individual provider knows what their agency, and in the case of nursing homes, I guess, in theory, we know it from cost reports, but that's a very manual, I think where we're going to fall to make this inventory something that is practical and that we can keep updated over time is going to be, administrative data of various types that we can rely on.
And one of the things that potentially comes from this exercise is, a need for additional administrative data to be collected in a practical and unburdensome way, right? And there's no goal to add additional burdens, but to the extent, additional metrics can be captured, as Paul said, so to keep this sort of, we'll call it a dashboard for lack of a better term, updated, that's another benefit that will come from this.
Okay, we have rate of entry of Maine Care. So do you mean like a percentage or anything to add to that, Sharon?
Sure. I'm kind of thinking if we're doing, I don't know, is there, and it may not even make sense to track this, but I think when I think system wide, I think if we can, if we have good services and supports, and we're building a system of services and supports, can we slow entry onto main care, right? Or if we see that accelerating, then, you know, are people, do we have a woodwork effect where people are coming out of the woodwork for the services? And so sort of looking at what's happening because we've done some of these things, what's happening to the number of people on main care? Is it increasing, decreasing? You know, is it moving in the direction we want it to move into? And understanding what those trends are.
You're saying, is it service-induced demand?
I'm sorry?
You're saying, is it service-induced demand?
Service-induced demand. Sorry, you're breaking up, David.
Yeah.
Oh, I'm sorry.
So in other words, not looking at what we project based on income and age of what we think the growth of main care is going to be, but more because of
what's actually happening.
Right. Okay.
Angela also added facility closures, bed capacity loss, and geographic disparities. Angela, do you have any additional context or note that you would want to add to that?
No, but Sharon has me thinking about main care. I mean, again, I mean, obviously who I represent, nursing homes and other long-term care facilities, but we already know main care is about 70% of our payer source. And so I think mapping out those trends over time, knowing that, you know, Maine is the oldest state in the country and the percent of the population that's growing, but also predicting what percent of that population will be reliant upon main care. And then of course, the associated demand that creates, I think across the whole LTSS continuum, you know, that's, my gut would say, only going to continue to grow and probably unchecked. So I do think that's really important.
And Angela, I would add to that too. What you made me think about too is where are they in the continuum of care? And are we slowing the progression from the lowest level of care to the highest level of care? Because if we've done a good job on the front end of home and community based, it stems the tide. And that means we're catching them earlier when we can do more to keep them off more expensive levels of care. And so understanding what's happening across the continuum might be very helpful. So if there's a way to sort of to see that, but to see that trend over time.
And to all of those points, recognizing that financial standing, rather than calling it just income, because a lot of seniors don't have a lot of income, but some might have a lot of wealth, in as much as health status, how functional a person is, the type of services they need can vary by income or wealth. Are there metrics out there, for instance, that would say when you're looking at someone well-to-do, their health status is such that they don't need to go into a facility, you know, until they're 90. Whereas when you have someone in a lower income bracket, you know, within that population band, you would expect a higher rate of needing to go into a facility as opposed to being able to stay at home. Are there methods on that sort of thing?
Functional status related to not only financial status, but also education.
So sort of, yeah, because that would really speak a lot to demand for different types of services at a geographic level. You know, how does the population break out in terms of educational attainment, income, and then what would logically follow, health status and ability to remain in their home.
Yeah, there's definitely a correlation between those components and demand. Absolutely.
Does the group?
Well, if I could just keep us on time, I'm seeing that we're getting close to the hour and we still haven't gotten to the third question.
Thank you, Karen.
then that's okay. I was just looking at the clock.
Every time I'm about to jump, we start getting great conversation. So I don't want to interrupt, but yes, we do want to.
I know it's really hard.
So how did we miss this? We have been over this slide deck 1,000 times. So then what format would be most useful in understanding or visualizing the needs assessment?
For example, we know we showed you when we talked a little bit about our methodology, one of the things we intend to do is include a graphical component which overlays, think about a heat map, overlays so basic demographics when you talk about where the population is by age and potentially by income, and now even education, and then you overlay or at least put side by side, where their services are. The map you saw, just as an example, showed the nursing facilities and the PNMI sees where they are. That was just an example, but we would also have similar maps that would show the different types of services, again against a backdrop of the demographic components, right? I mean, so that's one way, but other things, we're open to other thoughts.
Okay. So we have someone on the chat saying that they love the heat maps. Can you provide a little more detail there? Like, is there something in particular that you'd like to see in a heat map, or just the general concept is what you like? And we do only have like 2 more minutes, so get your fingers going.
Also, did you see the zip code? It sounded like more of a health equity related.
Oh, I did not, but thank you. I don't know how I missed that.
I captured that, Chelsea. So
yeah,
awesome. I had that. Thank you. Demographics along with other factors. Okay. Are there others who prefer tables or graphs, charts?
Infographic formats.
Infographic formats. Okay.
Infographic.
I mean, I'll just say from the department's perspective, we would want both, because the infographics and heat maps and so on are great for communicating what the status is and what we're doing. For actually tying resource decisions, we're going to need the numbers, right? And so we would want both for sure.
And just so you know, broadly, our plan is to both have a combination of infographics, tables, but if there's, certain things people want us to emphasize.
Okay. All right, I'm going to give it another 15 seconds, and then we'll go ahead and conclude and talk about future discussions. One more. Assessment of family caregiver supports available are also important. Okay.
That's a good one.
Yes. All right. So I'm going to go ahead and zoom out. Awesome. Thank you all so much for participating. I think that this was a great back and forth that we were able to achieve, and grateful that y'all felt comfortable speaking up. And so moving on, we'll talk about work group meeting schedule. So of course, today, April 5th, was our first meeting. We covered introduction and objectives, and of course, wanted to validate the LTSS services that we'll be including in the needs assessment, and of course, got a kickstart on some of the metrics and measures and the outputs that y'all felt would be most meaningful and helpful to you. Future dates are anticipated for May 3rd, May 24th, and June 21st. 5th meeting as TBD, just to determine if we'll still need that. Paul, Sarah, was the idea to have it at the same time, so 1 to 2 Eastern for these?
I mean, we're open.
We're not sure yet. Okay.
Yeah, if that's a good time for the group, or if it's as good as any, I think we could just, unless people have feedback about these dates or time, then we can just get these appointments on your calendars.
Sarah, did we set them up for 1 on an internal hold? Just check it.
Internally, yes, we did set them up for 1. So if that works for everyone.
Christina, is that an issue for 1?
Nope, 1 o'clock is great. If I know now, I won't overbook myself, so.
Right. Okay, well, sounds like 1 to 2 Eastern works for folks. If anybody does have a major issue with that, I think you can email Sarah and we can try to make changes. Sarah, I will clean up this deck and send you a PDF so that you can share it to the group.
Great, thank you. Thank you all for coming and joining our kickoff today.
Yes, thank you. We look forward to this series of meetings and getting good feedback from what is clearly a very well-informed and knowledgeable group. So thank you again for taking the time.
Thanks, everybody.
Thanks, everyone.
Thank you.
If there's, oh, by the ways afterwards, should they reach out to Sarah?
Yes, please.
My email is in the chat.
Put her email address in the chat.
Thanks, everyone.
Thank you.